Thank you for joining us today. My name is Leslie Cornwell. I'm a certified nurse midwife with Midwifery Business Consultation.
And I'm Melinda Bagaga. I'm a certified birth doula through Doula International and a certified childbirth educator through Hypnobirthing International.
Our goal today is to discuss the different kind of care providers you can see when you're pregnant and during delivery. We'll talk briefly about birth support team members, but our main focus today will be midwife, obstetrician, family practice doctor, and that team that you will have during the birth process.
Also, the support people that you might choose to have around you, namely birth doulas, and where their role comes in.
Yep, and birth assistants and a nurse during the hospital. So a midwife, which is what I'm the most familiar with, you can choose to see a certified nurse midwife, which typically has a master's in nursing or a master's in midwifery, depending on the school they went to. A certified professional midwife typically delivers in the home birth setting and sometimes at birth centers, depending on the state. They have an apprenticeship with an international certification. Some states do have programs. I know in Alaska they have a very good educational program for certified professional midwives. Direct entry midwives and biblical midwives and lay midwives tend to be informal apprenticeships within their community. Any other training of midwives that I'm missing that you could think of?
Not that I can think of.
Okay. And an obstetrician, typically, there's a couple I know of in the past that have delivered in the home setting for the Amish in our area, but most obstetricians deliver in a hospital setting. They go to medical school and then get advanced training through a fellowship with a hospital. A family practice doctor, they typically take care of moms, babies, dads, kids, the whole family, but they can also choose to do births. It is getting less and less common to see a family practice doctor, just partly because of liability, partly because of the way that the healthcare system is evolving into making it harder for family practice to be on call for the birth aspect. I'm trying to think. Once in a while, a maternal fetal medicine doctor will do the delivery, but it's mostly in the hospital, a nurse midwife or an obstetrician.
Mm-hmm. Those would be the most common.
Mm-hmm. Yep, and the scope is very different. An obstetrician is mostly trained in high risk, and a nurse midwife, a midwife in general, is typically trained in normal and then has the skills to send you off to high risk or take care of those emergencies when they're happening. So it depends on your personal history. Are you a person that has diabetes and extensive medical concerns, or are you a person that's overall pretty healthy? That will help determine the type of care provider you should be looking for.
Yep. And then if you are one of the ones that is very low risk, isn't really having any complications, maybe you could look into whether you want to pursue, finding a midwife in your area that delivers at a local hospital, or even looking into some of the birth centers that might be. Not all areas have birth centers, but if you did, you might find a nurse midwife in a birth center or at home. Yep. And then a lot of birth centers will have the certified professional midwives there.
No. And so after you choose your birth provider at the beginning of your pregnancy, you can choose to have a doula. And I will let Melinda talk about that because that's her expertise.
Yes. So there's a lot of misconceptions around what a doula is, and people, think that they go hand in hand with a midwife. They do basically the same thing. But a midwife will be catching the baby, and the doula will be there throughout your pregnancy, helping you, ask the questions or, think of the questions that you want answered and getting the education that you want. And then they will be there as emotional support, as physical support, helping you cope through the entire labor and delivery process.
I think it's important because there's so many kinds of doulas out there. There's some doulas that specialize in postpartum. There's some doulas that do just a little bit towards the end. Every single doula sets up their labor support, their prenatal support differently. So asking those great questions to the doulas when you're looking for one. When do you start labor support? How many times do you see me prenatally? How many times do you see me postpartum? So you have a better idea of what services you're getting. Mm-hmm. I know just from you and the norm in this area, but across the country, a lot of doulas offer their services differently.
Yeah. So learning the questions to interview a doula would be very handy to look up. Well, I don't think we need to go into that right now.
Yeah.
But
yeah.
Yeah, just knowing that a doula is different than a midwife.
Yep.
And
And
is a
you
great
don't
addition.
have to have a doula in the hospital. The nurses on labor and delivery unit are very good at helping with labor support. It's just that additional support of one-on-one if a nurse, because I was a labor and delivery nurse for a long time, if she has 2 women to take care of in labor or there is another birth happening, it's nice to have somebody you've personally hired to take care of you no matter what's going on in the rest of the unit, whether it's quiet or busy. So I am a big advocate of finding what works best for you. And birth, some people just use their husbands and some people like a whole team. So you need to find what you want your birth to look like.
Yeah.
After this video, we will go into more details with what are the different kind of midwives, the details, especially for if you're considering becoming a midwife, the educational background. We hope you enjoyed this video. Please subscribe to our channel and put any comments down there if you have more questions that we're more than happy to answer for you. Thank you.